bladder stones and one more woman's disease. So the thing is, why I've taken these women's disease, why I've taken diseases which are more common in women, because of 8th March being the International Women's Day, I thought I would do something a little women specific, So I just needed a theme, basically. Alright? So osteoporosis, hypothyroidism, anemia. We'll discuss it a little more in detail. The 5th one was rheumatoid arthritis. Okay, which I kept forgetting. Alright, so these are more common in women, but that doesn't mean, of course, that men cannot get it. Of course they can, but if it would be like 5:1, women is to men, the ratio is much lower.
What is the hypothyroid? What kind of disease it is?
Hypothyroid, we'll discuss that. Okay. Now, like he said, he wanted to know about hypothyroidism, which anyway I've taken it first. Now, thyroid gland, it's very kind of underestimated, We never think, even doctors normally don't think of thyroid gland if there's some problem. It's not put down to thyroid gland malfunctioning or something, but it is the most ignored gland, but it controls a lot of your activities, like your metabolism, your heartbeat, in children, the growth, mental growth, physical growth. It controls a lot of your activities, your rate of respiration, everything is controlled by your thyroid gland, thyroid hormones. Now, which are the hormones that the thyroid gland releases? It releases thyroxine, that's the main hormone, which is T4. And this T4 is an inactive form which is converted to T3. Okay? Now, suppose there is some malfunctioning of the thyroid gland, then your level of T4 falls. Now, when your level of T4 falls, now are you aware of the pituitary gland? Pituitary gland is your master gland. No, that's the hypothalamus. Okay, the pituitary gland is your master gland, which controls the working of the other endocrine glands. Now, when the level of T4 falls, then the pituitary, along with the hypothalamus again, which helps to regulate your temperature. Okay, so when there is this fall happening, then between the hypothalamus and the pituitary, they release a hormone called as TSH, which is a thyroid stimulating hormone, which will stimulate your thyroid to produce more of that T4 because its level is falling. Now, if your thyroid cannot keep up, like if the level of TSH increases but your thyroid cannot produce enough T4, that means there's a malfunction. So, when you go for a thyroid test, then your level of TSH and your level of T4 is seen. Your level of T4 is low but your level of TSH is high, then it's assumed that you are hypothyroid. Of course, there are other tests also there's no investigation. There's something called as antibodies also, thyroid antibodies. Now, these thyroid antibodies are something which is not in your control. It could be a viral infection that could lead to this thyroid antibodies, destroying your thyroid gland. They attack your thyroid glands, and either they will stimulate them to produce a lot of T4, or they will make the thyroid gland underactive. That means the T4 will be less. If it's less T4, depending on which antibodies attack your thyroid gland, it will be hypothyroidism where there is less T4, or hypothyroidism where there is excess T4. So less T4, your metabolism slows down. The person, becomes very inactive, starts feeling dull, low energy, starts gaining weight easily because metabolism slows down, your weight starts increasing. Whereas a hypothyroid person, it's the other way around. His heartbeat will be faster, metabolism is very fast, starts losing a lot of weight, which is not healthy because this person is losing a lot of muscles along with fat. It's not just fat that he's losing. Overall, he's becoming very thin. His energy levels are very high, he's very hyperactive, but it's not a healthy situation to be in.
The glands is in which place? In this place?
Yeah.
Actually, there's something in yoga which gets rid of this.
Yeah, yoga, it kind of activates your thyroid gland. Yeah. There are a lot of things like even diabetes that will help to control.
There's something they teach you, on yoga section.
Yeah.
To get this
yeah, there are some asanas. So thyroid hormones control your metabolism, the functioning of your brain, proper sexual development, around puberty, normal growth of bones. This is in children. Okay? Mental, physical development growth. hormones released T4, that is a thyroxine, which is the inactive form. So 80% of the hormones released is thyroxine, which is converted into that active form, which is T3. So this is just for your information, okay? T3 is the one that actually goes into cells and it's the active form that actually performs the functions. Now, between hypo and hyper, first of all, women are more prone to develop hypothyroid or hypothyroid. And between hypo and hyper, again, hypo is even more common. Like it could be probably 5:1, the ratio of hypo to hypo. Yeah. Now, hypothyroidism isn't, like I said, is an underactive thyroid gland.
What's the reason why women are more prone to?
See, the main reason, see, first of all, I think let's come to it a little later when we come to the causes. Okay? Now, hypothyroidism is an underactive thyroid gland. Hypothyroidism means that the thyroid gland cannot make enough thyroid to keep the body running normally. And hypothyroid, like I said, is only 1%. If this is 6 to 8%, that is about 1% people get hypothyroid. Now, signs of hypothyroidism, everything is slowed down. Reflexes slow down, movement is slowed down, body temperature is low, the person feels cold all the time, heartbeat is slow, BP is irregular. Sometimes it could be low, sometimes it could be high. Dry skin, dull facial expression, the voice becomes hoarse, swelling in the neck. Also, in case during puberty, there could be late, development, menstrual cycle would be late, and then it would be a very heavy flow that a girl will get. Then obesity, weight gain, inability to lose weight, constipation, muscle and joint pain, aches that a lot of people complain of when they have hypothyroid. Fatigue, weakness, slow pulse, low BP. Yeah, like I said, delayed sexual development, puffiness and swelling. Just yesterday, there was a 10-year-old who came, and around the time she was 8, she's been on treatment for about 2 years. So around the time she was 8, her parents felt that suddenly she was gaining weight. And gaining weight in the sense she was actually kind of bloating up, her face was looking all puffy. So then they kind of told their doctor about this, and he said get a thyroid test done, and it was said to be confirmed that she has thyroid. So puffiness of the face is also pretty common. And people go to depression also. Okay? Low sex drive. Now, hypo causes, this was in the past, the first reason. Too much or too little iodine. This iodine deficiency is almost out now. Right? So, this was in the past when there was
iodine in salt or water?
No, iodine is present in salt. It's a mineral, no? It's a mineral. It's found also in food, natural foods, eggs, milk, they have iodine. Plus, iodized salt. Where to salt, they add iodine. So that is now done. So now iodine deficiency is as good as not being there. Too much iodine also affects the thyroid gland. Now we come to the autoimmune disease, your question. Now autoimmune disease is antibodies. Now you know what are antibodies? Okay, when there's a bacteria or a virus enters your body, then your body produces certain antibodies to fight them. So now there are some antibodies which confuse your thyroid gland. It could be some other gland also, even the pancreas or any other gland. But in this case, of course, the thyroid gland. It takes it to be a foreign object and it starts attacking that. Now, women are more prone to this autoimmune diseases, like the rheumatoid arthritis that I spoke about. That is also an autoimmune disease where antibodies are attacking the cells of the body.
But why so with women?
That's a genetic thing.
Okay, it's a genetic.
Yeah. Alright. So this is a TPO antibody. Now sometimes when there is hypothyroidism, like I said, a further investigation, they test for this TPO antibodies. So it should normally be less than 9. So if it's more or around that, then they know that the person is suffering from autoimmune disorder. Okay, now this is thyroiditis. Like I said, it's an autoimmune attack. Now this can follow a viral infection. So this can sometimes be temporary till the viral infection is there. Sometimes it is there, sometimes it continues. Another reason for hypothyroid, surgical removal of part or all of the thyroid gland. Now suppose someone has thyroid cancer. So sometimes the entire thyroid gland is removed or only that affected part of the gland is removed. Okay, so obviously the amount of T4 it will produce because the gland is now much smaller or it's absent. So the person will definitely be hypothyroid because he will produce less hormones. I mean she, in more common in women like I said. Radiation treatment again, if a person has thyroid cancer or if a person has hyperthyroidism where the gland is producing too much thyroxine, then again a part of the gland is irradiated or it's kind of surgery is done to cut off a certain part of the gland or iodine is given to burn off that part of the gland. So it produces less. And congenital hypothyroidism, babies are born with like a thyroid gland which is not well formed or which is placed not in the right position. Then sometimes certain medications, like one of the very prominent ones is lithium, which is used to treat depression. So that can also affect your thyroid gland. And damage to the pituitary. Sometimes there is, like I said, pituitary is your master gland, which is controlling the amount. Suppose there is less thyroxine produced, then it starts secreting hormone to stimulate your thyroid to produce more thyroxine. Okay. So if there is any kind of damage, if there is a tumor, or if there is because of radiation or surgery, something has gone wrong with the pituitary, then also you will have this problem because then it will not be able to control the thyroid gland. Alright?
Pituitary gland controls all the other endocrine glands,
Yeah.
including
All the endocrine glands. It's a master gland. Okay. Now obesity and hypothyroidism. Now children, childhood weight gain, right? Children who gain weight, they are said to be more prone to develop this hypothyroid later on in life. Or even like adults who are overweight, obese adults, they are said to have more of the thyroid antibodies. So the chances of getting hypothyroidism are much more. So it's a vicious cycle. If you're hypothyroid and if it's not controlled or if you're not taking medication, you gain weight. Plus if you are already on the obese, in the obese category, the chances of having more antibodies, thyroid antibodies are even higher. So childhood weight gain and obesity are associated with adult hypothyroidism and autoimmune thyroid disease in women. But childhood obesity at 14 associated with appearance of adult hypothyroidism in both sexes. Okay, so when child is obese, women are even more prone to this. Yeah. Then like I said, obese adults are more likely to have positive TPO antibodies. Yeah, TPO antibodies are the thyroid antibodies. So the more chances of developing hypothyroidism. Then we'll just touch upon hypothyroidism. It's usually called as Graves' disease, where like I said, your thyroid goes into overproduction. This is again the antibodies are stimulating it to go into overproduction. Now, for a woman who is planning pregnancy, it's very important that the thyroid gland has to be functioning properly, because over or underproduction will not just affect her health but also that of the offspring, okay, of the baby. We come to this problem, first of all, conceiving a baby. Okay, she may have problems conceiving. Sometimes even after conceiving the child, there are chances of miscarriage. Similarly, hypothyroid women, even when she conceives, there are chances of the child being born pre-birth, preterm birth, or again there are chances of miscarriage. So it's very important for a woman. Now, if she's like you said, why is it more in women? It's always passed from mother to daughter. The hypothyroidism, okay, the autoimmunity thing that I said. So a woman should always, if she knows that there's a family history of thyroid, or if she's also had some kind of, like this thyroiditis where her thyroid glands were affected, then she has to get a proper thorough checkup if she's planning a pregnancy. Okay, and it has to be monitored. Throughout the pregnancy, it has to be monitored, the thyroid hormones. And of course, if a woman is already undergoing treatment, if she's already on thyroid hormones, obviously there will be an increased demand because the fetus also initially, at least for the first 3 weeks, it depends on the mother's thyroid hormone. Okay, it starts making it after 3 weeks. Also, then the iodine, the requirement of iodine increases. Now, what is iodine? Like he said, it's a mineral. Okay, now iodine and a protein called tyrosine, both of them form this thyroid hormone, thyroxine. Alright, so the iodine deficiency in a pregnant woman would affect the amount of thyroxine she makes. Now, a hypothyroid woman in inadequate treatment, suppose when they are giving those thyroid hormones, like it's given in the form of a pill. Suppose she needs a certain potency, but if she's getting something lesser, of a lesser potency, it starts from 25 and goes up to 150, I think. So she's getting something of a lesser potency, then of course the child will not be getting enough of the thyroid hormone. So obviously the child will also be of a low IQ. Like I said, there could be chances of miscarriage. And if it is uncontrolled, then premature delivery, fetal malformation, and the baby also could end up being hypothyroid. Now, like I said, iodine intake increased. Iodine has to be increased. The dosage of iodine has to be increased for the fetus and for the mother. And later on, initially the thyroid hormone has to be increased, and later when the fetus starts making its own thyroid, it needs to get additional iodine. Okay. Alright. Now, hypothyroidism, no cure, it can only be controlled. It's not like a lifestyle disease. It's not like diabetes or say even a cholesterol. Okay, where you can control it with the right diet and exercise. But that doesn't mean that people who are on medication for thyroid can just follow any lifestyle, like just keep eating the wrong things. You have to still maintain a diet, a proper diet and a proper lifestyle, because it will only help that medication, whatever you're taking for your problem, it will only help it to work better. Okay, so though thyroid, like once a person gets thyroid, he knows that it's for lifetime. It's some cases of course they go off medication, but sometimes the symptoms do come back. After some years it may come back, especially as a person grows older. Okay? So that is supposed to be the thing about hypothyroidism.
Medication is to be taken for life.
Almost, yeah, you can say that, yeah. So sometimes that is why some people go through a kind of depression, sometimes, because they feel they have to take medication for lifetime. Like I said, it's not a lifestyle disease. Like if something like an antibody, you can't do anything about it. An antibody attacking, if it's temporary because of an infection, then it's fine.
And the iodine intake comes from
Diet.
So what is the general diet we are taking?
Yeah, like
I
iodine
think
salt.
there is traces of iodine.
It's a trace mineral. You need very small portions.
That we get it in a
You
particular
get it,
diet.
yeah.
Nothing in particular.
Nothing in particular. Like especially if you're eating a balanced diet. That's it. See, like boost your thyroid function. Eat more of these great sources of iodine, like low-fat cheese, yogurt, cow's milk, eggs, saltwater fish, shellfish. These are like the main And it also says eat selenium-rich foods like mushrooms, onions, garlic, eggs, because eggs, beef, wheat germ, sunflower seeds, sesame seeds, liver, because they boost the working of the thyroid gland.
Wheat germ,
Wheat germ.
wheat germ is a top.
It's when the wheat is freshly plucked, the wheat germ they take off from inside. I don't know where you get it here, but you get wheat germ oil you get.
It is the inside the wheat.
That is the bran, what you're talking about. The outside one is the bran. No, the
That
wheat germ is inside.
inside.
Yeah, and that you get
But
only
inside the whitish one is there, brownish, then you break, then the.
yeah, when it's freshly plucked out.
Okay.
I don't know where you get it, or even I'm looking for it, but wheat germ oil you get. Now, I don't know how many of you have someone who's got a thyroid problem at home, but normally we hear of all these foods, eat less of all these foods, like they say avoid cabbage, avoid cauliflower, avoid broccoli. There's a whole list of food. I mean, if you just read this, almonds, cauliflower, millet, pears, corn, mustard seeds, mustard greens, pine nuts. I mean, the list is just endless. I mean, if you have to actually avoid all these things, you would end up eating nothing actually.
Yeah.
Yeah. And another, because it slows down your thyroid. It's said to slow down your thyroid. These are called as goitrogenic foods. Okay. And another one which has really got a bad reputation is soya, which again is said to block the iodine uptake by the thyroid gland. But having said all this, I mean, I have also written all this just to highlight the thing. There's a lot of these things floating around. But if you talk to an endocrinologist, he will say that don't avoid anything. You know, eat everything in moderate quantities.
Yeah.
Yeah, because see, how much would a person eat? It's not like, you know, if you're talking about cabbage, he's not going to eat like 1 kilo of cabbage every day, you know, then it's a different story.
Moderation is
Moderation, and you can eat like, you know, twice or thrice a week. Even if people eat, these foods are said to be bad, especially when they're eaten raw. Like, you know, raw cabbage. Of course, no one eats raw cauliflower, but you know, certain things that you eat raw, it's supposed to be bad, but even if you eat it raw, how much would you eat? So there's no really thing that, you know, no such thing as, you know, don't take this, don't take that. Even soya, a person who's got hypo or hypothyroid can eat a little bit of soya, maybe twice a week, thrice a week, and small quantities. Moderation is always, yeah. Now exercise. Of course, a hypothyroid is very important, especially for a person who's hypothyroid, to work out. Why is that so? Why is it important for a hypothyroid person to work out? To exercise, any form of exercise?
It would activate the gland.
No, not the gland, because this person anyway has low metabolism. So exercise increases metabolism. So it's a way of boosting your metabolism. So someone who really wants to also lose weight should exercise along with a diet, because metabolism is very low in people who have hypothyroid. And but only thing is that person may get a little tired. Okay. And hypothyroid, of course, again the person can exercise, again the person gets tired. And what happens in such cases, they have to be a little careful because they have a very high heartbeat. You know, their rate of heartbeat is high, especially people who are older. So they have to be a little careful. But exercising is a must, especially for a hypothyroid. Okay. Now we come to the next one, that is anemia. Of course, we all know anemia is reduced hemoglobin in blood.
less
Hemoglobin
in the blood.
in the blood. There's a hemoglobin which carries oxygen around. Okay, so that is less. Now, why is it less? One is nutritional deficiency, iron, vitamin B12 and folic acid. All three of these, they go to form your RBCs. Okay? Now, out of this, the most common is iron. Now again, when we talk about, like I said today, it's more of women specific, but iron deficiency is common in women who are menstruating, because they're anyways losing blood, and iron 70% almost is there in your in the RBCs. Okay, so when a person is losing blood, he is bound to lose a lot of iron. But iron deficiency, I mean, I'll just touch upon this. Iron deficiency in a man or in a non-menstruating woman is something which needs a little investigation, because then it means that the person is losing blood. It could be maybe piles, could be a sign of tumor, it could be ulcer, or in some cases it could even be like a parasite infection, like a hookworm. So something is happening where there is bleeding happening. Okay. Now iron requirements, it's not much actually, iron requirements. It's about 8 mg for women, and men it is 11. It's not. And menstruating women, of course, it's 18 mg per day, and pregnant women, of course, it's much more. Now iron deficiency, amount of iron in the diet inadequate. So even if it's a man who's iron deficient, one reason could be iron is less. I mean, he's not having a proper balanced diet. Another reason is malabsorption. You know what is malabsorption? It is food is not being absorbed in the small intestine. Could be something gone wrong with the lining of the small intestine. There are various diseases, like celiac disease. Then there's Crohn's disease, where your food is not getting absorbed properly. So that could be one of the reasons.
Why is it that the intake of vitamin C increases the absorption of iron?
The vitamin C increases absorption. So malabsorption could be, or amount of iron in diet is inadequate. Vitamin C, normally they say, like, for now when it's non-vegetarian sources, it is well absorbed. It's the vegetarian sources that are not very well absorbed sources of iron. So they always say source of iron like liver, meat, they are better sources. Okay? And excessive iron loss in bleeding. So they are indications of colon cancer, stomach ulcers, piles, parasites, even drugs like aspirin. If you're overdoing it, okay, then that could also cause bleeding, say stomach ulcer, which can cause bleeding. And of course, these are the iron sources, liver, meat. Egg yolk is actually not a very good source because
Cholesterol.
not because of cholesterol. Because in egg white there is a protein which does not allow it to be absorbed well. So egg yolk actually has a very good source is because see, even when you're talking about calcium or iron, if there are fibers in that food, so it will prevent the absorption from happening. So it won't be well absorbed. So like when we talk about calcium, dairy products are a better source rather than vegetables, because vegetables have fibers, no?
Dark green is a part of meat.
Yeah.
And what do you legumes?
Legumes will be something like peas, which you split open like that.
Banana.
No, green.
Green peas, yeah. Any of those are legumes. Which you split open, the seeds inside.
The nuts is the dry fruits and peanuts.
Nuts is not dry fruits, almonds and those. Okay, now other causes of anemia, folic acid
But
deficiency.
jaggery also got iron.
Iron, yeah, because they make it in such a way, they make it on those iron vessels, no? So it absorbs the iron, yeah, it is a good source.
Even dates have got
Dates have got even this thing, even that beaten rice, no, poha. That also they say has got a lot of iron because it's made in a way where it absorbs iron from that container. So it is the okay. Now other one is folic acid deficiency, vitamin B12 deficiency. Like when I told you about iron, folic acid, vitamin B12, hemolytic anemia is RBC destruction. Again, there is destruction of RBC, similar to that antibody thing destroying your own tissues. Nah? This is hemolytic. And of course, like I said, it could also mean certain other diseases plus cancers of the bone marrow where the RBCs are not forming properly. Okay, now folic acid deficiency. Again, this is dangerous in a pregnant woman because what happens is folic acid is very important for the fetus. For the spinal cord. For the growth of the neural tube. So there could be defects in the neural tube and this growth happens in about 21 weeks. So even before the woman realizes she's pregnant. So she has to have like rich, store of folic acid already if she's planning a pregnancy. This is something that they're very careful about. And whenever people have, like vitamin B12 or if a person is anemic, if their person is B12 deficient, usually B12 deficiency is a little rare because first of all, unless a person's diet is so bad, he's like on a vegan diet where it's a vegetarian diet plus there is no milk, dairy products because good sources of B12 are your non-vegetarian products plus your dairy products. So someone who's not on these, who doesn't eat these things at all, will have a B12 deficiency or if he has a problem, so again say a malabsorption problem.
folic acid also increases the absorption of calcium.
Folic acid.
Yeah, because I have seen there are those calcium tablets which also contain
Folic acid. See, it requires an acidic medium for absorption. Folic acid, calcium. It's better absorbed in an acidic medium.
Maybe that.
Maybe that could.
What is yeast? Yeast smoke?
Yeast you get, yeast tablets you get, plus the yeast
The
that they
tablets
use.
or what?
Yeah, you get these tablets forms you get. Plus the yeast that they use, no, in the
Very
baker's
bakery
yeast.
products.
Yeah. Then you have the brewer's yeast, which is different, but they are very rich. Huh? These they're very rich in nutrients. Okay. Then we come to the third one, osteoporosis, where we all know that we call it like bone loss, or the bone becomes very porous. Now, why does the bone become porous? Because the calcium from the bones is lost. Okay. Now, why is it lost? Because during the process of growth, we keep adding calcium to the bones, and it becomes denser and harder. Then after a certain age, and that is why they say, your diet should be rich, like you should have at least a glass of milk every day, because the calcium, when it helps the bones to form. Till about 25-30, they say your bones reach their maximum, like you have that peak bone mass. That means the maximum calcium that is deposited. After that, it starts, and of course, bone formation and reformation is happening all the time. It's called as remodeling. Like some amount of it will be kind of removed, and some more will be deposited. So till 25-30, your bone deposition is more than the resorption, it's called as. Okay. So after 30, they say that there's resorption happening, and also when a woman reaches menopause, say after 40-45, there'll drop in estrogen. So because the drop in estrogen, the bone formation does not happen where? Because estrogen, testosterone, estrogen is a female hormone, testosterone is a male hormone, which helps in bone formation. Okay. So now there's another different angle also to it. I don't know if you're aware of it. They also say that if your body is, see there's a certain, I don't know if you know of pH balance. Okay. There's a certain atmosphere in your body. It shouldn't be acidic, it shouldn't be alkaline, it should be more or less neutral. So if your body, the atmosphere inside your body, if it tends to be acidic, then to remove that acidity, the body wants to maintain it. It's, the fluid has to be at a neutral pH. So to become neutral, it wants to remove that acid content, and that it does by taking calcium from the bones to neutralize that acid content. Okay, so that means if you're eating a lot of
Acidic food.
yeah, so that thing of acidic food like animal meat, too much. I mean, if you're eating normal, it's okay. But there's some people who don't eat fruits, vegetables. They live literally on like animal products all the time. Like they're just eating a lot of meat and eggs. So that would create a very acidic atmosphere in your body. So that this thing is very bad for the bones, because the calcium from the bones is removed. Because the calcium, see, your blood calcium is there, and most of the calcium storage that is happening is in your bones. Okay, that's a storehouse of calcium. So if your serum, that means if your blood calcium level goes down, it will take calcium from the bones. Because calcium in the blood is also important to maintain your heartbeat, the working of your nerves, everything. That is important. Calcium is important for that. So if that level goes down, we take calcium from the bones. Similarly, if this acidic medium is there, in the blood becomes, let's put it very simple form, in a simple form, if the blood becomes acidic, then it will take calcium from the bone. The calcium is an alkali. It's a base. It will neutralize that acid. Alright? So, this definition is a little different. It is a condition of the skeletal system common in middle-aged and older individuals, mainly caused by the body's attempt to correct an unhealthy biochemical imbalance by utilizing the calcium that should normally remain in the bones, causing bone density loss.
No, you see middle age and older means what age? For women it is menopause, after menopause. For men?
For men, see, usually maybe after 50, maybe even much later. It
The
depends.
density of the bone starts.
Yeah, see, with age anyway, little bit of
But they
calcium
say
loss.
that if you are exercising
Exactly.
regularly,
If you're
then
exercising, if your diet is good. See, there are some people who are very weak, generally poor health, they're very weak, the diet is bad, they're not exercising. So it's you can't give like a cut-off age, for men. But for women, generally they say after
But
menopause.
exercise definitely helps.
Exercise
you to
definitely helps even for women.
retain the bone.
Yes. Exercise and diet is there for everything. Yeah? And unless certain abnormal endocrine or gastrointestinal conditions are present, the biochemical imbalance may be corrected by diet and lifestyle changes. Now, when we talk about endocrine, like for example, someone who's hypothyroid, he loses a lot of calcium from the bones. So they also get into almost a similar osteoporotic stage. Gastrointestinal conditions where your body is not absorbing nutrients. I mean, the intestine is not absorbing nutrients. Okay, could be a certain malabsorption problem like a celiac disease or a Crohn's disease where it's not absorbing. So such a person will always be lacking nutrients. Okay, risk factors. Besides that, let's see. Like I said, hyperthyroidism, that is the second one. Hyperparathyroidism. Now, parathyroid glands are again somewhere here, and they are, if too much of parathyroid hormone is there, it removes calcium from the bones. Hyperthyroidism, again, calcium loss happens from the bones. Long-term use of certain medications, thin and small body frames, family history of osteoporosis, cigarette smoking, that also helps, removes calcium from the bones. Excessive alcohol consumption, lack of exercise, poor nutrition, poor health, too much salt. Again, too much protein also has salt in it. So too much protein, too much animal protein, too much salt, more excretion of calcium, more removal of calcium, malabsorption, low estrogen levels of course in women, and immobility. Person who's kind of bedridden, or obviously that may also because of vitamin D deficiency, unless a person is taking supplements. Also, when there's immobility, then there has to be certain pull of gravity. When you're walking around, so that pull of gravity on the bones will also cause that deposition of calcium. That is the reason when you exercise, when you do weight training, they always say that it's good for the bones. It helps the calcium to be deposited. Like I said, this acidic food, serum calcium levels 8.5 to 10.2. So bone loss occurs when there is excessive accumulation of body waste. Body pH is this neutral, around 7.35 or 7.45. And if serum calcium level falls, it takes it from the bones. And of course, you have to consider that with age, there is going to be a slight decrease in bone density. No matter how good your diet, exercise, but then you can still, you can delay it with a good lifestyle and proper diet.
Acidic food is mostly non-vegetarian.
Mostly non-vegetarian food, yeah. You'll be
Milk is
surprised,
also
even milk is supposed to be acidic, huh? So excess wouldn't do, but not the fermented dairy products. But milk is regarded as
What
acidic.
about curd and paneer is also acidic?
No,
No,
not once it's
Milk
fermented, no.
is there.
Yeah.
Chas is okay.
Yeah, they're all fermented. Anything
In
that's
the earlier slide, we saw that blood thinning medication
That means
is
sugar
for
is also
long term. That
added.
means those cholesterol reducing tablets, they are also blood thinners.
They are also blood thinner. They are too much. See, all these are going to have
Long term medication.
long term.
Yeah, sugar is also
That is why one
acidic.
should always stay off medication. Try and control diseases.
The current lifestyle,
Yeah, that is true. Current lifestyle,
certain,
there are
things
people
like
with high
just,
sugar levels also saying that we are going to control it only with medication. So everyone has that thing. They don't think of the long term. They just think of okay, I can control it today with medication. But long term, all the medications are going to have their side effects. No?
Yeah, sugar is acidic.
Sugar, yes. Salt.
milk we thought was alkaline, but is it
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 is.
is acidic? Even cow's milk?
Yeah, it's only, I think that raw milk is said to be,
That's not possible.
Yeah.
What we are consuming.
yeah.
So, we
what
better
we are-
take it into the
No,
fermentation.
you can take it, but excess. See, again, when they're saying about avoiding acidic foods, doesn't mean avoiding them completely. You have to, like I said, you cannot be on a completely
No, but
non-vegetarian
if
diet.
you want to take some dairy product to increase your calcium intake, then better take it in the yogurt form or something
Yeah.
like that. That would be better
That
than
is
taking
better.
a glass of milk.
No, no, one glass of milk is fine. But you know, like taking more, excess. One glass is fine. Not more. Like, you know, if people who consume 2-3 glasses.
1 glass per day, maybe
It's fine, yeah.
half in the morning and
Even if you're consuming 1 full glass in the morning, that's okay. But excess is not good. Of course, this is the T-score. You know, this is by which they measure that bone density. The thing is called DEXA. The test is called DEXA, and it's like an X-ray thing where it measures, like, you know, someone who's got greater than -1. Less than -1 is greater than -1 is normal. Osteopenia is the stage before osteoporosis. So between, you know, on the scale -1 to -2.5. So if you're on the positive side, if you're greater than -2.5, that means 2.5, 1.5, everything positive numbers, then you are osteoporotic. Now the supplements, we are all aware of calcium, phosphorus also is very important, magnesium. Now the other unknown elements which people don't look at, everyone talks about calcium, vitamin D when it comes to bone health. But of course there is phosphorus also, that is important, magnesium. Then these are trace, yes, boron, zinc, copper, manganese, which are all important for the bone health. And surprisingly, manganese deficiency is found in women with osteoporosis, same with vitamin D. A lot of people are lacking in vitamin D today. Vitamin D and B12, surprisingly. A lot of people. Zinc, copper, manganese work together for stronger bones. Vitamin D, we all know the importance. Vitamin K also is important. Vitamin C, because bone is made up of course it's made up of a protein, it's made up of collagen, and of course it's made up of minerals. So this vitamin C helps in the formation of collagen. Then estrogen, testosterone and vitamin D increase calcium absorption. Estrogen is a female hormone, testosterone is the male hormone. And antioxidants, again very important, you know, when we're talking about bone health, eating a lot of fruits, vegetables, that is also very important. All the antioxidants are present.
green tea is also.
Green tea, yes, but then green tea excess is not good. Huh?
Excess not good.
Excess is not good.
How many cups is allowed?
I would
Green
say
tea with
about,
the lime.
no, that is even worse. Don't add lime to it.
No, we should not put lime on it.
It's not into hot water. That's said to remove calcium from the bones. So green tea, if you have like,
Warm or a little bit warm is okay, no? Then you can put.
why do you put calcium in that?
If I drink green tea, I put jaggery and the lime. Not hot, not very hot.
No. But why do you put jaggery in green tea? It's supposed to be had without this.
The
Honey,
jaggery
honey.
without
Honey.
it become bitter.
Yeah, but then that's the thing, you know, a lot of you make green tea, like you'll take 1 cup and put that green tea back for a long time. Don't make it so strong, no? You'll never be able to drink it that way. Make it very dilute. Then you can have like 1 tea bag, you can keep it for
3-4 times.
Exactly, that's how I use it, and
Yeah.
you enjoy drinking that green tea. If you take 1 cup,
Do you put jaggery?
Nothing.
And lime, nothing.
Nothing.
Just
plain, but I have it dilute.
You mean you use one bag for 2-3 times?
Yeah.
Yeah, for the entire day, that 1 bag I use, that is a normal.
But honey is good, it's like
For what?
green tea.
It's just for taste, people do.
Huh, but-
It's like putting sugar only, no?
No.
Sugar.
No,
I mean,
that
it's-
is somewhere.
but that tastes bitter, no? When you drink like that.
No, but when you drink it dilute, it doesn't taste bitter because you'll make it very strong. If you're going to use 1 cup and use one entire tea bag, keep it for a long time, then it's going to become bitter. Then you won't feel like having
We
it.
keep 3 minutes.
3 minutes, hot water, I think that's going to make it concentrated. If
But
it's
does
going
that harm you?
no, but if
It's
it's
given
going
an
to have,
instruction that you have to put this.
no, that of course because they want you to use more tea bags, no?
No, but you say you use one bag 3 times a day.
Huh.
Instead, if you use one bag once a day, and
I won't feel like drinking, it will be too concentrated.
no, forget drinking. Is that does it have any adverse effect?
No, it's not adverse effects. It's just because it's dilute, so I can drink 3 cups like that in the
But if
day.
you can drink that one bag in one
It's
sitting,
okay,
that's
yeah,
And
it's
you
okay.
don't take it for a second time during the day.
Yeah, but then, yeah, I guess so. Yeah.
The
If you
lime
don't mind the
Actually, it
taste.
can have 3 dips actually, legally. It can have 3 dips.
It can have, of course, it's quite concentrated. Unless you really want to drink very strong green tea, which I don't think, it doesn't even taste good.
It tastes better.
Yeah, it tastes bitter.
The lime, should we put lime in the hot dal? Not, dal should be not
No,
hot.
no, dal and all is okay. If I'm talking about when people put hot water and lemon and nimbu, they take that to reduce
So
weight.
foreigner they drink this black tea with lime in the hot
Yeah,
tea.
so
I see.
foreigners
Actually,
do a lot of
they
things
say
which is
that-
not
they say
correct, no? Just because they do it doesn't mean it's the right thing. I know they do that.
Yeah, in the hotels, I have seen it.
In fact, I have also seen one man who's, who used to have coffee, black coffee every day before his workout, that he was doing cardio at least thrice a week. When he did his bone density test, he was in his 40s. He did his bone density test for a man in his 40s. His bone, this was very low. The calcium, the density was very low. That could be since for almost 2 years he'd been following that practice, drinking black coffee every day. And strong coffee, because it increases your metabolism.
Coffee is not good for health. Coffee.
No, limited quantity again is okay, but tea is better, they say.
So better than tea, herbal tea is good,
Herbal tea is good, then of course, but nothing in excess is good.
But these all are gimmicks, quite honestly. It is.
Yeah?
Yeah.
Okay. The green tea is better?
Green tea. You just have to add on to increase your price.
To increase your?
Price actually.
Ah.
Even I was reading, the Satya Sai Baba says, fruits are sattvic, If you drink too much, it's become tamasic, So that has to be in moderation.
Of course, even fruits
Everything
have to
in
be
moderation.
Everything has to be
Like even a
moderation.
diabetic, if he has a small portion of fruit, it's not going to affect his blood sugar. But if the same thing you
Yeah.
have too much, it is going to affect his blood sugar. No? So fruits also, a lot of people say it's natural, so we can
Yeah.
eat, but that's a wrong concept. No, anything that's natural cannot be. You can't overdo anything. No. Okay. Then when it comes to this bone health, of course, exercise, like I said, plays a very important role. It helps in the uptake of calcium, helps to strengthen your bones, and also
Exposure to sunlight.
exposure to sunlight, of course. Vitamin D, that is.
But
it's not.
They say that it should be in the morning. Is
Not
that
morning. It should be between 10 to 3.
that time the heat
That
is
is,
much
it's
more.
yeah. But that is the time when you will
But
have
there are a lot of
15
controversial statements. Some people say it has to be in the early morning.
That is for
Some
children, I think, early
Some
morning.
people
But
say it has to be in the mid afternoon.
no, but the person who I have got this information from is someone who's been involved in research. He's a doctor himself. He's an
According to that, what
endocrinologist.
time?
10 to
Afternoon.
3.
10 to 3.
Yeah. That is the best time when you can absorb, and make vitamin D. But of course, then there are always supplements, no? You have the Arise and Uprise, which are good enough for people. People who cannot really go out in the sun, or people who don't want to go out in the sun. And of course, people use a lot of sunscreen, no? So that also, if it's 8 SPF, then your absorption is really cut down. You don't get anything then. So vitamin D cannot be
Regarding
given.
this green tea, I make hot water, and I put off the gas and then put little bit green tea for 3 minutes. This is okay to make. This is the right way to make it.
Yeah, of course. That is the way you make. You're not supposed to boil it.
Yeah, that is the right way.
Yeah, you
Also
just-
very little bit.
And then you strain it off. No?
Yeah, still.
Yeah. That is the way to. You don't have to boil the green.
No.
Yeah, just in hot water you put it
Yeah.
and then strain and then have.
But
Or
only
3 minutes are okay, no? 2-3 minutes.
2-3 minutes. It depends again how strong you want to make.
One sachet is 3 times.
Yeah, I average on an average. I use it
That is-
thrice.
that's
Otherwise, I
the
can't drink it.
Yeah.
It's too strong. Yeah, exercise. Another effect of exercise, it strengthens your muscles, it strengthens your body. So as a person gets older, it gives him better balance. So you're cutting down your chances of losing your balance or falling. I'm talking about people who are much older now, but it helps to maintain. That's it. Okay. Achha, the other two, of course, I have not made slides on that because we just discussed that. Rheumatoid arthritis and which is the other one, gallbladder stones, which again is more prevalent in women. What is rheumatoid arthritis? It's when your smaller joints are affected. Yeah, you get the. It's again, like I said, your body is creating the antibodies are attacking your own body cells. The synovial joints, the synovial fluid is affected. So there is, people have a problem, like women, even men, of course, very few. It's smaller joints like your fingers that are going to be affected. So there's going to be stiffness, early morning stiffness. There's going to be redness. And in extreme cases, of course, now again, this deformity can be controlled if the person is on medication right from the beginning and exercises. So again, your diet, exercise, lifestyle makes a lot of difference here. So you can avoid the deformity. Otherwise, people have those, those deformed fingers. Women have that. And of course, in the case of this diet, there is no special diet as such, but it's an inflammation. So inflammation, so that means you have to take good fats, like say omega-3. You have to cut out the bad fat from the diet. A healthy diet, of course, you have to eat. So, but when I say omega-3, that means you have to take natural sources like walnuts, flax seeds, fish oils.
How many walnuts? 1, 2 pieces, whole piece?
Walnuts you can take about 2, 3.
2, 3.
Yeah.
Not more than
Actually,
that.
say 4.
They say 4.
4.
Okay.
Because I've got a guy who delivers almost all India of the dry fruits.
Acha. Okay.
In any case, it's become very expensive now, so you can't afford
More,
it.
more than 4, yeah.
Walnuts have become very expensive now.
300 rupees for half a kilo.
No, it's not.
I have a guy who delivers to almost
Is it?
yes.
It's very cheap.
We should take this.
Normally it's 1500 a kg or something.
Yeah, I don't know, depends probably on variety. But he's a source house of all information. I have a number.
I mean, I come from an advertising profession, so
Huh. Okay.
The gallstone, what is
Yeah, gallstone is, they say like you have bile in your body. So there are some remnants, some when the bile is emptied out, some part will remain, some bit of cholesterol. They form stones in the gallbladder. Okay, so that is the gallstones.
Even uric acid.
Uric acid is different.
They
That also forms kidney stones are
Kidney
there.
stone.
Yes, yes, that is
calcium,
different.
more calcium can form the stone.
That is in the kidneys, yeah. But this gallbladder stone, again, you have to maintain a healthy diet for that. Cut out saturated fat, cut out like fats. Saturated fat, unhealthy fat, so that chances of cholesterol formation is much lesser. Have more healthy fat, healthy food. Ultimately everything boils down to like good nutrition. And of course exercise to lose weight. That also helps, no?
very important.
Very important.
Exercise can be done up to what age?
Any
Up
age.
to any age.
Any
I've seen
age,
people
even
at
now.
80 exercising.
80, 80
Yeah,
plus.
yeah. If you go to
I-
London, people are exercising.
I run 20 kilometers every day.
Yeah.
Every day.
And how old are you, tell them?
No,
Okay, he doesn't want to.
I have joggers park, very place where I
Yeah.
stay.
Exercise is,
Means
there's no
80 plus
bar.
also can do
Of
that.
course, that's
Why
because your
does-
body should be able to handle.
That Fauja Singh at 103 he ran a marathon.
Who?
Fauja Singh.
Okay.
Okay, he came abroad from Punjab, and he did this, and he that football player, what is his name? He got rid of him to be on the poster.
Oh.
Fauja Singh,
Oh. Okay.
104 years old now.
So there's no age.
There is no
for
age. Only you
exercising.
should be
There are
doing it from
people-
the.
Yeah, but it should be
Yeah,
done
you
from
can't
basic.
start, yeah.
You can even start late, like people.
But then gradually. Like.
Gradually, of course, because there are people who come to me and they say, "Oh, but I'm already 40, I'm already 50. How can I start?"
It's all in the mind,
exercise?"
actually.
It's all in the mind. Then I have to counsel them, but then there's no age when
All
you
of a
can.
sudden they
Actually,
can't
there is
do
no
all.
age for anything.
For
but
anything, exactly. It's all a mindset. It's all about how you look at it. But when they say that I'm 50 and how can I start
No,
exercising?
the
I'm
only
like,
problem is that sometimes the body becomes so rigid, it's not flexible.
No,
so
you
you
don't
But
do-
you can always
Gradually,
slowly
gradually.
relax
If you
your-
don't do it, it becomes non-flexible.
Yeah, if you don't exercise, it will remain like that. But if you start somewhere gradually, it will open up. So that way, there is no age bar or age limit to exercise.
Regarding kidney stone, what is the cause of kidney injury? stone in the kidney.
See, some people have this tendency. Yeah, I think we've discussed.
Yeah,
Next one,
No, no, no.
No, we finished with